Healthcare innovation is hard work. It calls for building cross-functional teams, collaborating outside hospital walls, and integrating technology with different models and lenses. It's also about building the capabilities of people and amplifying the voices of patients and families. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Petterly, Senior Writer with AHA. In this podcast, Jay Bhatt, Senior Vice President and Chief Medical Officer of the AHA, and Andy Shin, Chief Operating Officer of the AHA Center for Health Innovation, discuss major trends in 2020 and beyond as healthcare organizations build teams to advance clinical care and drive innovation.
We're seeing so many exciting developments in healthcare now. Leadership and clinical teams are driving innovation, collaborating with community partners, and ensuring healthcare addresses the needs of patients and communities. Andy, what are healthcare leaders working on in 2020 to build a culture of innovation at their hospitals and health systems?
Thanks, Jay. I think that when we're talking about building cultures of innovation, it's worth taking a step back just to define what the heck we're talking about. You see sometimes innovation being used to describe digital transformation or risk capital like venture and startups. So at one level, innovation is about activating others and influencing behavior change. But the way we define innovation here at the AHA is about shifting mindsets, changing practice, whether that's care delivery, operational, or even new business models, and then what we describe as transformation at scale. So what are those breakthrough or even disruptive innovations that we can scale by working together as a field? So in answering your question, I think that as we're looking at some of the major trends in 2020 for hospitals and health systems, when it comes to focusing on innovation, I'll talk about two. One is I think there's continued investment in building formal innovation teams or even centers. So these teams bring new capabilities to bear from human-centered design to product innovation or even digital transformation. And we're seeing some health systems go outside of healthcare to build these teams. They're looking at retail and tech, for example. What we're seeing now is a trend where you've got your established team and you're integrating those teams or innovation work into the fabric of the organization, into the processes, systems, so on, that really form the heart of an organization. So what we're really starting to see from the old model, which is form an innovation team, set them loose, and then go ahead and innovate, is now trying to de-silo those teams, saying how can we work much more cross-functionally? How can you formulate strategy, as well as expose strategies that are frankly not likely to unfold as hoped, and then fully resourcing those teams, not using a hierarchical or matrix structure, but really allowing them to be fully resourced and unleashed throughout the organization, and forming teams based on problems, not about hierarchy or function. Finally, the second theme that we're seeing is really looking at collaboration outside the four walls of the hospital. And you're seeing this on the ground a lot, Jay, which is health systems are more and more staking out their role in transforming healthcare and leading that charge. And so we're seeing right now hospitals, whether they're major employers in an area, they might be the community center, literally, or sponsoring access to healthy food or affordable housing. These anchor institutions or anchor strategies are really important as we try to transform our current system towards a more patient-centric or consumer-centric system that has well-being at its core. So it's not just the top-of-class care you receive when you get sick, but you're seeing these kinds of partnerships form everywhere with community-based organizations like the YMCA, schools, housing, even to tech companies and big employers. And so the common thread amongst all that is how do we leverage our platform as hospitals or health systems to help every community and person achieve their highest potential for health. But, frankly, I think that this is a theme that has probably been only accelerating. It's something that's not new. But what are you seeing on the ground, Jay? I mean, you're talking to clinicians and leaders every single day. Does this resonate with you?
Thanks, Andy. I think your themes are spot on. I think we're seeing doubling down on investment and innovation in a number of different ways, from care delivery models to virtual to digital to consumer-focused approaches. And I think that you're also seeing this collaboration go beyond the four walls, from ambulatory to post-acute to virtual and then retail and other non-traditional players. I think about this issue in three areas, the three Ps: patients, people, and partnership and progress. And so I think what we're seeing emerge is that the voice of patients and families is being lifted up by clinicians in this conversation about innovation. What role do patients and families play as partners in health to reimagine the future? Because they're feeling it in not only their families, they're feeling it in their bank account, they're feeling it in their lives, they're feeling it in their care, and it's impacting, I think, the way that clinicians show up and take care of patients, and then the voice that clinicians have in driving innovation. And that's where it comes to people. I think we've got to invest in our people. The clinicians need support in capacity building around innovation. We're seeing more and more of that happen. Certainly AHA, Center for Health Innovations, assisting with that along with the AHA Physician Alliance. But I think that there's going to be continuing need to help clinicians change mindset, change practice, and to your point earlier around the innovation framework, be able to contribute to transformation at scale. And the other piece related to clinicians is clinician well-being. We've got to change the system so that it is easier for clinicians to do the right thing, easier for them to do what they're trained to do, and easier for them to take care of patients. And then I think partnerships is critical. I think we're going to see critically important partnerships emerge, other ones strengthen, whether it's between clinical leaders and non-clinical leaders to advance a vision of an organization, or between hospital health systems and community partners, as you alluded to. I think that the role hospitals and health systems have in community and the role that their teams play in driving the health of communities is going to evolve as well. Just on the issue of housing and health, we're seeing incredible work there, given that the life expectancy of those with unstable housing is 27 years on average less. And so the progress that we're going to see is going to depend on, how we build the capabilities of clinicians. And we're understanding that if these teams don't work effectively together and don't have capacity and skill set for innovation, we're going to have a hard time addressing the affordability issue and continue to not have better outcomes for our people in our country.
Yeah, I love how your three Ps, that's really interesting. And a lot of folks are asking, what's the next 10 years look like? What's the 2030 hospital of the future? And one of the things that I keep stressing in these interviews or in these conversations is hospitals are not necessarily four walls and a building and a bunch of technology. They are those things, but they really at its core are people, right? They're the clinicians, they're the teams, they're the administrators, they're the IT folks, they're teams of people who are coming together around a common purpose and shared goal of serving patients in their community. And I think that when we think about what the hospital or health system of the future looks like, you have to start with the people. So one of the things that I wanted to pick up on when you talk about the role of a clinician or even physician leader, nurse leader, is sort of thinking about healthy communities. And so you talked a little bit about some of the trends that you're seeing in terms of healthy communities, but what are you really excited about that you're seeing sort of on the ground that is going to just really be sort of, I think, a transformative innovation moment? Social determinants for you and I have been regular parlance for the past decade, but now we're seeing everyone start to talk about social determinants. Startups, tech companies, everybody's really interested in it. So we'd love to get your sort of take on what do we have to look forward to now that everyone understands the role of social determinants? What's the opportunity for this year, for this decade?
I would say that one is building greater awareness of the difference between social needs, social determinants, and systemic and structural problems. I think that we often in this conversation lump them all together, but they require different skill sets, different systems, different ways of approaching people that are impacted. And we often send people back to the conditions that make them sick. And so that's, requires partners and hospitals to work differently around changing those conditions. But then there's the real need that people have right in that moment. And we got to take care of that, but then work on these sort of more upstream long-term issues. I'm really excited that hospitals and health systems are applying the skills they have in quality improvement to this issue of social determinants. Getting more rigorous, evaluating interventions, understanding what works and what doesn't work, and sharing that. Because I think that that's important. And I also see that it's part of a larger health equity strategy. And we know that quality and equity are two sides of the same coin. You can't achieve high-quality, affordable health care without addressing inequities in care. And those inequities sometimes stem from the issues related to social determinants of health. So I think for rural and critical access hospitals, this is a critical issue because they don't have necessarily the resources, but they have the relationships. It goes back to the issue of people, that they understand their community and the people well. And so how do they use that along with the employers in the area to reimagine how they might address their community health needs and do it collectively? This is the piece where scaling transformation makes important. What can we do together on community health that is harder to do alone? And I think that's the direction you'll see.
Yeah, I think that's a great point. And again, it comes back down to the people. And, I was just at JP Morgan in San Francisco this past week, and it was really interesting to see how every health system, every provider organization that was there, they were talking about patients and consumers as if we were all Amazon, right? We all know that Amazon is customer obsessed. And I think that hospitals and health systems have really focused on that growing recognition of how we can make care more convenient, how we can reduce the friction and access and still deliver the highest quality, safe care possible. And it really does go beyond the sort of tech bells and whistles. It's really at its core how you facilitate the time and space and ability for, again, the caregivers to be able to connect with patients. And so that could be over telehealth, that could be over a video conference or in the computer screen or in the in a traditional office or even in the community setting. But the point is that hospitals and health systems really are honing in. And this year, I think you're going to see a lot more progress in whether you're rural or in a large urban area, focus on trying to facilitate that connection.
Well, I was going to ask you, I think you're absolutely right. Either from JP Morgan or some of your visits with members, what are some of the unique strategies or examples you're seeing among the field to address both innovation capacity and some of the challenges that they might face in 2020?
Yeah, thinking about the role of digital, for example, is really important here. And so often we think about digital as sort of this ubiquitous umbrella term, but there's really two ways of thinking about it. One is digitization of an organization, like implementing an EHR system or streamlining operations through digitization. But the other side is going digital. And I think in going digital, that's really about new value propositions or new opportunities to add value to patients, to consumers, to communities. And so I'll just use telehealth and virtual health as one example. So if you're in a community that's hard to access specialty care or services because you're in a rural setting or not able to drive to a health system that might be anywhere 2, 3, even 4 hours away, think about the power of the ability to turn on through your smartphone instantaneous connection to a specialist who could be thousands of miles away, who can really provide that level of care and attention that it would otherwise be almost impossible to get. And then add on top of that technology like artificial intelligence and machine learning, natural language processing, all these buzzwords that really boil down to one thing, which is you can get technology-inspired improvements that can really make care more personal, more accessible, and frankly, higher value, because it can be more affordable and you can get access to that in ways that can be really meaningful. And so it really doesn't matter if you're in a rural community or an urban center. Virtual health has so many applications to really improving the health and well-being of communities. And so that's sort of one area I think we're seeing a lot of progress around. On the other hand, we're also seeing, I think, and you're at the center of this and some work that I'd love you to talk about through the design studio, which is how do we take these major assets of things like the electronic medical record, things that were really important, have been very important to making data more accessible to clinicians, for researchers, to improve care and streamline operations. Yet we've seen some challenges, almost a decade in some cases in some implementation. And I'm wondering, would love to get your opinion, Jay, on the opportunities where we can actually take the promise of electronic medical records and actually make them more usable, more effective for clinical research, to actually harness that power of big data or even little data and improve care. And would love your perspective on what hopefully is on the horizon.
Sure, and I'll just pick up on something you said about some of the elements of the future. I think the piece around data is really important that you alluded to, and I think how hospitals and health systems and other organizations engage with technology companies or other partners around data privacy, and the use of data is going to be important, and that has implications for electronic health record usability. I think if you ask patients about whether they'd be willing to contribute their data, if it's going to be used for good, I think that they're very supportive. And I think we've got to make it easier for data to be used for intelligence that lifts all boats and helps patients get better care. So I think we know the EHR is a burden. It causes challenges for care delivery and for clinicians because they're spending more time on keystrokes than they are looking patients in the eye and talking to them about their care. So that's part of one effort in the design studio related to scaling transformation is we're bringing our members together to design and do something for improving care delivery and equipping care teams with the right tools for care delivery so that the EHR is more usable. And the other area, which is a big issue, I think we're going to see a lot of activity on is behavioral health. I think it's going to think about it in the terms of care models, in the terms of workforce, in the terms of financing, in terms of access. And so I think that in 2020, if we don't make some headway on behavioral health, we're going to be further behind.
That's such a good point. And behavioral health is one of those wicked problems you hear some people talk about. Because and I think that's one of those opportunities where you're going to leverage technology, you're going to leverage new models of care. You sort of need to throw everything at it because whatever we've had up till now doesn't seem to have really moved the needle.
Yeah, I agree. And I think it's going to be a mix of approaches and solutions that'll help make the difference. There isn't sort of one thing. But we have some beacons of hope around this. We have organizations that are doing regional hubs with telehealth. We have organizations that are looking at their community assets or lack thereof and creating a comprehensive approach to wrap around services and community needs. We have folks looking at social isolation. So I think that's important. It ties to the third issue we're working on is around accelerating risk. What are the payment and delivery models of the future that integrate behavioral health and physical health, that support behavioral health? That's not an issue that people are going to compete on. You got to cooperate on to make a big difference. And hospitals and health systems that are self-insured are taking on risk already. So how can that be a runway for even greater engagement in risk models? And I think this question about what is the value-based care models of the future is going to be an important conversation in 2020.
It's interesting that we don't often think of it this way, but you're hearing more and more from the startup community that the ripe opportunity for them to innovate is in actually Medicaid programs. And I think part of that is that the way that Medicaid programs are structured, they're aligned, the incentives are there to really focus on these wicked type of problems, and many of them are sort of moving towards that sort of value-based framework that you're talking about. It makes me think that value was probably one of the major topics of the last decade. I think it'll probably continue to be so for 2020 through 2030.
Yeah, it's how do we help patients get the right care that they need, and how do we make it more affordable for them and help clinicians and care teams be best positioned to serve our patients, families, and communities. Now, the AHA Center for Health Innovation is working on these issues, and you're leading some great work with the center. What's going to be some of the key areas of work in 2020 to help the field sort of on this innovation journey?
Yeah, thanks, Jay. And I think that there's a ton of noise out there. And if there's anything that we really need to focus on this year and this coming decade is trying to decipher the clear signals and the early warning signs from that noise. And so we continue our work that we call market intelligence, which is really what are those major topics, those issues, such as behavioral health, such as digital transformation, new care and delivery and payment models, and then how do health systems and specifically leaders actually start tackling those issues in ways that are focused on formulating strategies, iterating, testing, innovating, and then actually implementing and sustaining those innovations as they transform their systems. And that's work that is hard. It is things that are really focused on operational, focuses on culture, as well as processes. And that, from our perspective, is the hard work that we have to now do. This is much bigger than and much more in-depth than a PowerPoint presentation. It's really the hard work of transformation. And so we're doing everything we can to try to smooth that transformation for health systems because they are, in many ways, leading the way in terms of transforming the system. And so, one of those key elements that we're really going to focus on for this coming year is going to be leadership, because it's going to take leadership in order to do this. And at all levels of the organization, it's going to take, obviously, leaders of organizations. It's going to take clinician leaders, physician leaders, nurse leaders. It's going to take IT and innovation leadership, transformation leadership. You're seeing the emergence of the role of chief transformation officer show up a lot in health systems. And so one of the things we're doing to help this process is something we're calling the Next Generation Fellowship, which is taking a fellowship program that has been longstanding at the AHA called the Transformation Fellowship out of the Health Research and Educational Trust. We took a year to go to the field and say, what are those competencies and capabilities that the future leader needs in order to lead that hospital or health system of the future towards a society of well-being? And what we heard back were, there's some attributes that are very different from what you're taught in business school or in a program for hospital administration. It's really about things like social determinants, as we just discussed. It's understanding little data and big data. It's being able to forge community partnerships and understand how to engage stakeholders in the entire healthcare ecosystem. You're hearing a lot about how emotional intelligence and things like clinician well-being and resilience, cultures of well-being, these are things that were not necessarily taught 10, 20, 30, 40 years ago, or even today in some cases, but yet they are necessary daily capabilities and competencies that leaders need to have. And then the last thing we heard was we do so much better when we're together and not apart. And so how much can we gain as a community of mentors, mentees, of peers, both within the healthcare system field, but also across the healthcare ecosystem, whether it be employers, payers, and others, technologists, in order to really figure out how do we build together a health system of the future. So we're really excited about that. We've actually opened applications just recently, and we're taking nominations through the end of February, and we hope that people will nominate rising leaders within their organizations, because this is going to be a very special opportunity. One special part of this opportunity is actually the John A. Hartford Foundation, which is providing scholarships for folks who are focused on age-friendly health systems, and something you happen to know a lot about, and would love for you to share with everyone what that part is about.
Sure. Thanks, Andy. And I think I just want to pick up on this notion of better together. I think that's how we're going to advance health in America. That's how we're going to bring the care that patients need and deserve and really drive innovation forward. So I think age-friendly health systems is a reflection of that. This is an area where the Institute for Healthcare Improvement, the John A. Hartford Foundation, the American Hospital Association, and the Catholic Health Association came together to envision and improve care delivery for older adults. Starting with 26 sites in 5 pioneer organizations several years ago, Ascension, Kaiser, Providence St. Joseph, Trinity, and Anne Arundel, we are now over 350 sites in 42 states deploying this model called the 4 M's: mentation, mobility, medication management, and what matters to you, which is on patient and family preferences. And this bundle being deployed reliably for older adults in both the acute and ambulatory environment as well as the post-acute environment is really making a difference from the way that we're seeing the data come in from those that are deploying it. And so this Next Generation Leadership Fellowship provides an opportunity for a group of fellows supported by the John A. Hartford Foundation to design their approach to deploying this 4 M's bundle and get supported in that process and see the organization improve care delivery for older adults.
That's great. And so I think that just sort of summarizing what we've talked about today, it's leadership, it's people, it's thinking outside of the 4 walls of the building. It's thinking about how to integrate technology with different models, different lenses of approaching wicked problems. Did I miss anything?
Well, I'll say just investing in building the capabilities of people and amplifying the voice of patients and families. Even just recently at JP Morgan, I heard big buzz about a woman on a panel who came and sat there in her hospital gown to sort of demonstrate or illustrate kind of that patients have been missing in the innovation conversation. So I think some really interesting initiatives and impact is going to happen in 2020. And we're really just grateful to be a part of it, to be a trusted partner, voice, and resource for our members through the Center for Health Innovation. And Andy, appreciate your leadership and partnership and the insights you shared today.
Thank you, Jay. That is really well said, and everything you're doing to really engage the clinical leadership throughout our health system and all the work you're doing to really accelerate transformation at scale is going to be really important work, and really happy to partner with you on this important work along with all our member leaders, and looking forward to the year and decade to come.
Great. It's a wrap. Thank you all for listening. Check out the AHA Center for Health Innovation website at www.aha.org/center.